Hey guys, I want to talk to you a little bit about chin implants. Chin implants are used to build the surface of the chin forward. So a chin implant is a great idea when someone's chin is soft, and because their chin is soft or recessed, it makes their nose look bigger than it really is, and it makes their neck look worse than it really is. And on profile, it makes their proportions not exactly as good as they could be. So chin implants these days come in many different varieties. My favorite variety of chin implant is what's called a silicone or silastic chin implant. They're made of all kinds of other materials as well, but I like these silicone chin implants because they are super smooth, not porous. Because they're super smooth and not porous, they almost never get infected, and they can be easily swapped out. If a person doesn't like their chin implant, we can easily swap it in, swap it out, put a brand new one in with really no trouble. There are other kinds that have big pores in them, and they have a higher infection rate, and they're hard to get in and out. Silicone chin implants, 99% of the time, if I place a silicone chin implant, the patient's going to love it, and it will last their whole life. They're not like breast implants that routinely need some kind of maintenance or leak or form capsules or that kind of stuff. Silicone chin implants, for the most part, are a lifetime device. So it's one of the very few things that I can say, if you like it, it will last a lifetime. If you don't like it, it's 100% reversible. That's a very unusual statement in plastic surgery. Maybe a 1% infection rate, but it's really rare. So chin implants come in many different shapes and sizes. So I have here two very different chin implants. And so every time I describe a chin implant to patients, I think the first thing they worry about is this one. I've never used this chin implant my whole life. This is a ridiculously strong kind of bumper. If you're old enough to know who Herman Munster was, this is a Herman Munster kind of shaped chin. Almost nobody do we use this on. Something like this is a much more common chin implant. This is what's called an extended anatomical chin, and it's actually a lot smaller than it looks. It only adds that much to the front of the chin. So these are placed directly on the bone, and they're intentionally kind of long on the two sides because they taper and they blend, so you don't have a little bump in the front. These blend so that they are imperceptible. Once these are in, the chin looks stronger on the side view the way it should. And if you look at the before and after picture that we're going to put up here again, you'll see that her jowl is hidden because the chin implant tapers all the way into the little dent, and then it makes even her jawline look cleaner because of this limb. We call this an extended anatomical chin implant. So that's the most common variety that we use. Chin implants are, even within a given shape and design, they are not one size fits all. Each of these comes in multiple sizes. So for instance, this extended anatomical chin comes in 4 different sizes that we might use. We might use a real little one, adds very little, maybe a millimeter or 2, or we might use a heavier one that adds 4, 5, 6 millimeters to the front of the chin. Each of these, in turn, because they're silicone implants, and I love silicone implants, each of these in turn could actually be custom sized. So one of the things that I do on almost every implant in the operating room, if I think, for instance, the tail's a little too long, if the patient's jaw is asymmetric and they need more augmentation on one side and they need less augmentation on the other side, what I can do in the operating room, sterilely, is custom carve and custom tailor a chin implant so that it has the right fit for that patient's face. So for instance, if this particular patient had a stronger jawline on their left and a weaker jawline on their right, I might custom carve and custom tailor this implant to give them more strength on their weak side and have a nice tailor finish on their strong side, so that when I put this in, it actually gives them better balance. So that's what we use chin implants for. We give you a couple more before and afters here, and you'll see a lot of them are done in conjunction with the facelift, in conjunction with the rhinoplasty. We do sometimes do these alone. If we do them alone, it's about a 40-minute procedure. It's done under sedation. They're one of my favorite things to do because they make a really great difference. So please feel free to comment below with any questions you have about chin implants. Feel free to reach out to us. We'd be happy if you want to send us pictures. In the comments section below, we can tell you how to send us pictures, and we can give you an idea if you're a good candidate for a chin implant or not. Thanks so much for watching.